Okay, our group project is on personal protective equipment, better known as PPE. Okay, we will be discussing what PPE is, some examples of it, why we use it, where you can find it, how does it relate to individuals with disabilities, the current issue with PPE, and what can be done to help with the issue. Okay, for starters, what is PPE? It is designed to provide protection from serious injuries or illnesses resulting from contact from chemical or physical or mechanical hazards. Most PPE is used for protection of the following: respiratory system, eyes, nose, mouth, skin, hands, feet, and ears. PPE helps protect the human body alongside help from other equipment and procedures, for example, washing your hands or hand sanitizer in the individual's work area.
So what are some examples of personal protective equipment? The following are the most common types of PPE used. So gloves, masks, goggles, body gowns, aprons, earplugs, and face shields. Why do we use personal protective equipment? PPE is used to act as a barrier between the human body and the hazards to the body. So Cower writes, this barrier acts to block the transmission of germs from blood, body fluids, and respiratory secretions. PPE may also protect patients who are at high risk for contracting infections through a surgical procedure or who have medical conditions such as immunodeficiency from being exposed to substances or potentially infectious material brought in by visitors and healthcare workers.
Where can we find personal protective equipment? Depending on what occupation or work field an individual is in, you can find PPE just about anywhere. The following are some examples: the healthcare industry, construction industry, cooking or food industry. Due to COVID-19, PPE such as face masks in New Jersey are required to enter any public place. You can find any individuals wearing some type of PPE wherever you go in today's society. How does personal protective equipment relate to individuals with disabilities? Statistically, individuals with disabilities are at an increased risk of contracting any type of virus or disease. This is because individuals with a disability tend to have a weakened immune system. These individuals are also at higher risk because they tend to be at a disadvantage for receiving proper health care. In settings such as group homes, hospitals, or rehabilitation centers, it is hard to control the spread of any given virus.
The current issue with PPE. Because we are in a global pandemic, the demand of PPE is at an all-time high, whereas the supply is not. The World Health Organization has warned that severe and mounting disruption of the global supply of personal protective equipment caused by rising demand, panic buying, hoarding, and misuse is putting lives at risk from the new coronavirus and other infectious diseases. Because of the shortage, healthcare workers as well as the patients in these healthcare settings are out at risk. This can thus contribute to the rising numbers of COVID-19 cases. What can be done to help with the issue? According to the CDC, here are a few ways to help with the shortage of PPE in healthcare in these current times. Reducing or canceling elective surgical procedures and non-critical/non-urgent outpatient visits. Reducing face-to-face healthcare workers encounters with patients. Limiting the number of visitors to healthcare facilities or cohorting patients in HCWs.